right? But in general, how I approach medication is the kind of big picture. Why would someone even consider use of medication? And the answer most of the time is that they see it as a tool to help them get better. There is something in their life that is not, there's something going on. There are symptoms that feel uncomfortable. They're not functioning in the way that they want to be functioning. It's kind of a quality of life issue, and there's something going on. And medication is one of those tools out of many that someone could use to help them maybe get to where they feel like they need to be. Right. So this kind of idea of what you're going for, and maybe you've always been an anxious person, and I think it's important to distinguish, long-term issues versus short-term acute issues. And so if you're someone maybe who's been anxious your whole life, have tried therapy, it's worked somewhat, but it feels as if you need a little bit more support, you might be someone who decides, I might want to be on this medication if it works for you a little bit longer term, because it's something that just helps kind of move you to an area of kind of a lower level of anxiety kind of consistently. And that might be something that you choose that you want to do. Other people have more acute episodes of anxiety or depression, and they just want to get back to their general baseline. And that's kind of where people think, okay, well, that might be something that's more of a short-term use of medication. And I always tell people when we start medication, it's not forever. It's, let's commit to about a few months just to make sure that we kind of make sure your symptoms resolve, make sure we really get everything kind of going well. And then we have that discussion, okay, is it time to stop medication or not? And I tell people, there are some people who start meds and they're like, I'm great, I love it, I don't want to go off. And there are no known medical long-term consequences of most medications. And so I'm talking in general. There might be consequences of certain ones, but in general, the medications that we use for anxiety, like the SSRIs, don't have long-term negative medical consequences. And so it's really a personal choice if you want to remain on these medications long term. Other people say, I've taken these medications, I feel like I've done well, but I've also, it's allowed me the space to be able to really use those tools that I've been really working on in therapy. And I don't feel like I want to be leaning on this medication much longer. And so that's one way to think about, maybe, it kind of allows you to just get to a space to really focus on the work in therapy. You get the momentum going with that, and then we can maybe pull back the medication and potentially even go off of it.